Jake, and probably the one at Free Clinic all work basically the same. The Chattanooga, a lot of clinics have this, is a little bit different. And it's kind of a love-hate relationship. You either love the Chattanooga or you don't want to even go anywhere near it because you're afraid of it. In some ways, it's way easier to use. In other ways, students think it's a little bit more difficult. But I would think if you're into electronics, you may be into that. That has like a whole library inside of the thing. So, anyway, so this one here, the nice thing about these modalities is, first of all, this machine does lots of things. It's going to do IFC and pre-mod. It does laser. It does ultrasound and combo ultrasound. It does biphasic and Russian stimulation, high volt. The nice thing is you pick the modality that you want, and everything that you need to adjust will have a little light on next to it. So the machines almost tell you what to do. So if I hit sound here, all right, now not combo ultrasound because I would hit it again, but if I hit sound, do you see the light next to the timer goes on? So I can adjust the timer. We're going to talk about frequency. We're going to talk about duty cycle, and we're going to talk about intensity. So that's how I know what I need to change. So don't panic because these machines tell you what to do. So those of you who've used ultrasound, how long do you use it for?
8 minutes.
Because that's the insurance coverage, correct? I believe. So usually, huh?
Is it 5 minutes though to be?
Well, it's usually 5 minutes for an area twice the size of the ERA, which we haven't talked about. So the ERA is a little bit smaller than the sound head. So for an area twice that size, which is about this big, it's about 5 minutes. So most ultrasound is probably 8 to 10 minutes. I mean, you don't do ultrasound for 15 or 20 minutes, and you don't do ultrasound over someone's entire back. It's a very select area that you need to put it on. So I'll do 8 minutes because that's usually what insurance coverage will pay. So that's the time. So the other thing lit up, it says 1 MHz, 2 MHz, 3 MHz. Does anyone know what those stand for? Megahertz. All right. Ooh, that sounds a little like physics, right? So 1, 2, and 3 megahertz is all about the frequency of ultrasound. Okay. So the frequency is like how many wave cycles it takes to get past a certain point in 1 second. All right. So we're going to use, because most clinics use a 1 and a 3 megahertz. All right. And so that is the frequency. So it's all about the depth of penetration. So this is when you need to look at the target tissue and figure out, is the target tissue you're working on, is it something superficial or is a target tissue something deep? All right. So this 1 megahertz actually treats deep tissue. 3 megahertz actually treats superficial tissue, and that's kind of counterintuitive to what your brain thinks. And I can draw something on the board that will tell you why that is. And actually 3 megahertz actually, even though it treats superficial, tends to heat up more than 1 megahertz does, which treats superficial tissue. So say we're doing an upper trapezius muscle, which is very common. People have muscle spasm. Is that a superficial or a deep muscle? Superficial. So would that be 1 or 3 megahertz? 3. All right. If I was treating someone's piriformis muscle, would that be 1 or 3 megahertz? All right, that would be 1. If I was treating someone's rhomboid, yeah, so right, so really there's layers of muscle over the rhomboid usually, so that could potentially be a 1. What would you use 2 for? Maybe a rhomboid. But we're going to stick with 1 and 3 because that's what's common. All right. If I was treating a joint capsule for something like adhesive capsulitis, would it be a 1 megahertz or a 3? A 1. Anything around the joint and the joint is deep. So a joint capsule is deep. A bursa is considered deep. So if I was treating a trochanteric bursitis, it would be a 1 megahertz. And usually a tendon, where it attaches to the bone, can be considered deep. And then you look at all the other superficial muscle. Like if I was treating a gastroc, medius muscle, the muscle belly, I'd probably do a 3 megahertz. How you know is what to do is, first of all, I have those guidelines, but after 3 or 4 treatments of ultrasound, if you're not getting the results that you want, then you need to start thinking about changing the parameters. And usually by about 6 treatments, so about 3 to 4 treatments, you need to think, do I need to change some settings? Do I need it to penetrate a little deeper, maybe a little bit more warmer? But by 6, if you're not getting any positive results, you don't just keep going and going with the ultrasound. So that's kind of the little rule we're going to use here, all right?
So, with the ultrasound, is it, when you say 4 treatments, is it 4 treatments in a week or spread out over?
Just depends. Usually, you know, if you do 3 or 4 treatments and you're not getting the results, you need to start changing some of the parameters, because maybe it's the parameters that you have that you're not getting whatever your goals are. But I mean, you don't go and treat, you know, 20 times and 30 times and 40 times. You know, usually by about 6, you got to think, well, is there another modality that could be a little bit better, a little bit more beneficial for my patient? So that's frequency. It's about the depth of penetration. So now there's something that says 10%, 20%, 50%, and CONT, which means continuous. What's that about?
Whether it's heating or healing.
So that's called duty cycle, all right? So duty cycle basically is the amount of time that the machine is on. So we're gonna use here, because most clinics will use a 20% and the continuous, all right? So continuous is equal to 100%. So that means the machine is on all the time, 100% of the time. So if you're getting that output from the machine 100% of the time, that means you're gonna get a thermal or a non-thermal effect. Thermal, you're gonna feel the heat, it's on 100% of the time. So now the other setting we're going to use is 20%. So that means the machine is only on 20% of the time. So you see now you're going to get a non-thermal effect. So 20% or any of the percentages other than continuous means that it's a pulsed ultrasound. It's kind of an on-off cycle, all right? So guess what? So continuous or 100% is thermal ultrasound, so that's going to be used for more of a chronic condition, okay? And especially where you want stretch to the tissue, maybe contractions, maybe old trigger points. 20% or non-thermal ultrasound or pulsed ultrasound is going to be used for more acute or subacute injuries, all right? Where you don't want the heat, but where you want healing, where you want that change in the membrane permeability, where you want to bring in good circulation to something to have it heal and get rid of some of the swelling. Does that make sense to everybody?
When you say on-off, you're talking about the sound waves?
The power. The power is actually on. We're going to talk about the sound waves in a minute, but it's the power is not on 100% of the time. It's a pulse setting. Okay? Yes?
Yes.
Okay. All right. And then the other thing is the intensity. So we're going to have a little rule here so I keep everyone on the same page for testing purposes. So when we're using continuous, which is 100%, that means we want a thermal effect. We're going to start our power or intensity on 1.0 watts per centimeter squared. And that's going to be our starting point. So when we talk to a patient, we're going to say, let me know if you feel a slight warmth. That's okay. It should never feel hot or burning. And then depending on what the patient feels, I've gone up to 2.0 watts per centimeter squared, or you can go down a little bit, but that's your starting point at 1.0. Now for 20%, which is a non-thermal setting, we're going to start at 0.5 watts per centimeter squared, because we don't want the patient to feel heat. It's subacute. We don't want the patient to feel any heat. And if they felt heat when we're doing a non-thermal setting, we need to lower that intensity, because that's not the purpose of our treatment.
0.25 you said?
0.5.
0.5?
Yeah, and it's watts per centimeter squared. Can you write down what that looks like? Like 0.5 watts per centimeter squared and 1.0 watts per centimeter squared. Okay. So now, before we start it, because I'm going to do demos for treatment. So before we start it, you get a lot of patients with ultrasound, because a lot of machines you won't really feel warmth or a lot of warmth. Or maybe you have it on a non-thermal setting. The patient says, how do you know that's working? I don't think it's working. well, maybe there is truly a problem with the ultrasound. So what we're gonna do, excuse me, is we're gonna do, and everyone's gonna do it on each of the machines, but I'll just do one. And I'll show you. Who likes experiments? I used to love experiments, love them.
Blowing stuff up. That was tight.
Well, hopefully it's not gonna blow up. Oh, is it gonna be too short? No. Just made it. So I like to do this experiment because it's going to explain what ERA is and BNR. So let me tell you what they are, and then we'll throw water on here and you can see it, because I'm a very visual learner, and I'll tell you the words, what those mean, but when I see it, it's like, ah, I get it, right? So ERA is effective radiating area. And so the ERA is always smaller than the sound head. So under this sound head, there's a thin crystal. It has a funny name. It's called the piezoelectric crystal. It's ceramic. It's wafer thin, okay? So that's why you have to be careful that you don't like hit this or drop it, because once the crystal cracks under this metal head, the machine isn't any good. So, and the ceramic crystal is cemented in. And a machine is only as good as the crystal itself, all right? All right, so let's, oh, okay. So the effective radiating area, that being said, is always smaller than the sound head. Thank you, just take that. So it's the area of the crystal. When I turn on the power, you're gonna see a vibration, and you're gonna see about 1/4 of an inch around the perimeter that is not vibrating, because the crystal is not as big as the sound head. So let's hit the start button. And all right, so now for this one, you need to look down, and actually, you know what, let me just change, let's get a, yeah, but I want to even get it a little better. Let's try that. That's even better. So if you look down, can you see there's maybe 1/4 of an inch around the periphery? So that means the crystal is that small. So that's the effective radiating area. It's the amount of the sound head that you see vibrating where power is coming out. So it's always smaller than the actual metal that you see, all right? So sometimes this is called the sound head, or sometimes another word it's called is the transducer. So you may hear either. So that's the effective radiating area you're looking, not quite the whole area that's vibrating. Now, BNR is beam non-uniformity ratio. So that means the output coming out of here is not uniform. And so according to our government in the United States, whatever we put on this machine, if I have 1.5 watts per centimeter squared, the parameters are such that it can be almost 6 times that amount and still be considered okay. So that's a little scary, right? So how you can look at that is if you look at from the side, and this is pretty good. Can you see little peaks and valleys? If I put it up higher, right? And so the fact that it's vibrating tells you that it's working. So any patient that doesn't believe you can say it's working. But this has just been probably serviced not too long ago. So sometimes you really see these big peaks. So that means that these peaks, it can be up to 6 times more powerful than what you have here. So that, well, no, but that has a potential to burn a patient. So that's why when you treat, you have to keep the sound head moving at all times. So if you really look, can you see some of the peaks and valleys? So that means it's not uniform heating, and that means it has a potential to have an output much more powerful than what you have on here. And that's the reason why you have to keep it moving so you don't burn a patient, whether it be thermal or non-thermal setting. So BNR is the peaks and values, and ERA is looking to see how much surface area of that sound head is actually working, which is only as big as the crystal. Does that make a little bit more sense? All right.
Do you put the power up before you make contact with the skin, or you do it as your motion on the skin?
No, what I, all right. So before you turn power on to these machines, you always have to make sure there's some type of a medium here. So most of the time the medium is going to be this gel, But I will show you how to do ultrasound underwater for like over a bony prominence. So we do it in the water. So if I put this on right now, the power, with nothing here, I'll fry the crystal. So it always has to be in contact. And what was your question now that I said that?
Like when I was taught to do ultrasound, it's put the ultrasound head on the skin, move it, and then turn the power as you do it.
Correct, right. We don't hold it up here with a medium and put it on, right. That's actually, we're gonna call that a safety issue.
Okay.
So, and this has happened, I've had a couple lab assistants in the past where a student is doing the ultrasound and they get very nervous. Dina's, I don't know how Kim is yet, I don't know, and rightfully so, because you guys are learning and Dina is very nervous, and I would be very nervous too, that you're not moving it, because if you stop moving it, you can burn the patient. So sometimes your patient may like pull away a little bit. So if they pull away, you just stop the machine, reset it, and keep working. It's not your fault. You wouldn't get marked down with that, but I just don't want you to put it back on. These machines are new enough where you're not gonna shock someone, but some of the old machines, you just don't know, so we're just gonna play it safe. And there's all kind of parameters I'm gonna show you. I'll do demos and talk a little bit about more of it. So what I want you to do is I want you to practice. I'm gonna totally shut this off. So I want you to plug in, spread these 3 machines out, kind of split up. I don't know how many of you, if there's 9 of you, 3 to each machine. I want you to try to go through some of this